Hello, guys. Thank you for joining today for this webinar on approaching FRCR and Eagle Eye View. I'm Ebinesh. I'm currently in the UK. I'm I worked as a consultant at United Lincolnshire Teaching Hospitals, and now I'm now doing my subspecialty training in pediatric radiology at Alder in Liverpool. And this webinar is about what is to just give an overview of what FRCR is all about. And so in the next hour or so, I'll be taking you through uh, I'll be taking you through the various parts of FRCR and what are the resources available. And by the end of it, I'll be happy to take some customized questions that you have regarding FRCR preparation uh, or anything pertaining to FRCR or maybe life in the UK or something like that. And I thank Nishant for giving for having me here. And let's go into it. So most of this information I've taken from the Royal College of Radiologists website, and few are my own views. So the resources, I think someone annotated this. Yeah, thank you. So most of the resources and materials that I'm mentioning on this presentation are based on my own views and or the views of my of the people I know who have found it beneficial. And I'm not being paid or sponsored by any organization. If I'm endorsed, if you feel like I'm endorsing, or if I'm saying mentioning a few names, it doesn't mean I'm getting paid. One disclaimer is that I'm currently the course director at Study FRCR, but this is not pertaining to Study FRCR, but it is just educational. I'm not promoting it or anything like that on this platform. So coming to FRCR, FRCR is Fellow of the Royal College of Radiologists. It is offered by the Royal College of Radiologists, and everyone is expected to clear. Everyone who wants to practice radiology in the UK clears FRCR, be it a UK resident or be it an international resident. Everyone clears an FRCR to work as a consultant, basically. So FRCR exam has three parts. That is part one. Part one has two modules, that is anatomy and physics. Part Then we have final part A, or which is also called 2A. 2A is theory based and it has two papers. And final part B, or 2B, has two components, that the reporting and the oral component. So coming to part one has anatomy and physics modules. So physics is all MCQs. MCQs as in it will be just true or false questions. Yeah, it will be conducted over 2 day period. So you'll have one day will be anatomy and the other day will be physics. And we currently have three sittings. One is in March, another is in June, and another is in September. So you can sit both anatomy and physics together, or you can sit anatomy separately and physics separately. But to have cleared part one FRCR, you should have cleared both. So you to go to 2A, to clear 2A, you should clear both anatomy and physics and then go to 2A, or else you won't be allowed. You have a maximum of six attempts that are allowed, but beyond six attempts, you can still take a seventh attempt. For a seventh attempt, you'll have to say that you'll have to give reasons. How have you improved yourself after six attempts, and what have you done to improve yourself? So once you prove that, you'll be allowed to sit a seventh attempt. But I haven't seen anyone going for six attempts for FRCR part one. So. Yeah, this is directly from the RCR, the Royal College of Radiologists website. You'll have 40 questions. So 40 questions will be, you'll have one stem with five statements each. So you'll have an option of A to E, and something like this. So you'll have one stem, and each stem will have five statements, and you'll have to say whether each of the statement is true or false, right? So FRCR part one is just about true, or part one physics is just about true or false. You don't have you don't have multiple choice questions. It is just to say is it true or false. So you'll have 40 such stems. So 40 stems of five statements each. So that will be 200 marks, right? So you'll have 40 stems like this with five statements each. So 40 into 5 will be 200 questions in paper one, right? So, and one thing that I want to emphasize when if you are preparing for your part one FRCR is that, or your FRCR physics, is that radiography and fluoroscopy, nuclear medicine, CT, MR, ultrasound, all modalities, you're going to get six questions in all the modalities. So it is wrong if someone says CT and MR are important and X-rays are not important. No. So you're going to get six questions from all the on each modality. From all the modalities, you're going to get six questions each. So each of these modalities is important, and radiation safety is as important as any other imaging modality, right? So this is for you to understand, right? So yeah, it will be something like this. You'll have a stem with five statements. Each statement you'll have has to be marked true or false, and you'll have a total of 2 hours time, right? You'll have a total of 2 hours time to answer 40 questions, just true or false, and you don't have negative marking. So one good thing about FRCR is till now we don't have none of the FRCR exams have negative marking, right? None of the FRCR exams have negative marking. And what is different in FRCR is like how in India, I assume I assume most are from India. So how we have AERB guidelines, in the same way the UK has IRR and IRMER, ionizing radiation regulation and ionizing radiation medical exposure regulation. Ionizing radiation regulations, this is for staff and general public, and IRMER is basically for patients, right? This is basically for patients. So this is something that you'll have to know about, because radiation safety is all about IRR, IRMER, and personal protective equipment, on which you're going to get six questions, right? So for every correct answer, you'll have 1 mark. For every wrong answer, you'll have 0 marks. You don't have negative marking in FRCR in any of the exams of FRCR, and there is no fixed passing marks. The passing marks varies with each sitting. It usually is between 150 to 155. So depending on how difficult the exam is, so it depends on how everyone performs. So it usually varies between 150 to 155 for every sitting, right? So if you're practicing, if you target for 160, I would say target 160. So if you target 160 marks, you'll be safe. The most important topics for FRCR Part 1 physics will be image quality, that is factors governing image quality of all the modalities of X-rays, of fluoroscopy, of mammography, of MR, of CT, of ultrasound, then radiation dose metrics and indices, and artifacts. So if there are artifacts, what is the cause of artifact? How does the artifact appear on imaging, and what are the solutions to resolve it? MR safety and specific absorption rate kind of things, and how is image formed in nuclear medicine, and IRR and IRMER. So if you cover these topics thoroughly, you can be assured that you'll get minimum 60 to 70. This will cover minimum 60 to 70% of all the questions that you're going to get for your exam. And we have a lot of resources that are available for FRCR physics. So offline resources, the gold standard that people usually recommend is reading FARS Physics for Medical Imaging, but it is something that's very concentrated. So it's very concentrated. Every word becomes important. The simplified it's a simplified physics notes that you can use is FRCR Physics Notes by Sarah Abdullah. If you want a hard copy, you'll have to order it on Amazon, but the soft copy, it is available free of cost on the Radiology Cafe. So on the Radiology Cafe website, you have the entire soft copy, which is available free of cost, that you can use for your FRCR preparation with with very simple illustrations that will help you understand physics easily. And for MCQs, we have a lot of these MCQ books, like MCQs for First FRCR by Vardhana Bhuti, and Get Through FRCR by Grant Mayer, and Physics MCQs by Shehzad Ilyas. So these are the three most commonly used MCQ books, but there are many more available. But these are what I prepared only on Vardhana Bhuti. I used only Vardhana Bhuti, but people say they have also found the other two useful. There are a lot of online resources that have come up. So the RCR, the Royal College of Radiologists themselves, have now introduced a physics preparation course for FRCR Part 1. So that is something that many have opted. And Revise Radiology is a widely used platform, and they have an FRCR Part 1 preparation course. And Study FRCR, where I am working with, also has an FRCR Part 1 preparation course running over 3 months and 6 months, which have been producing good results in the recent times. So coming to anatomy, anatomy is not like physics. It's not true or false. It is, or is it not? It is not MCQs. So you'll be given 100 images. You'll be given 100 images, and each image will have one of the parts that is labeled. You'll have to say what that part is, and for 100 images you'll have 90 minutes, right? For 100 images you'll have 90 minutes. For every correct answer you'll get 2 marks. For every partially correct answer you'll get 1 mark. For every wrong answer you'll get 0 marks. Again, for anatomy you don't have a fixed passing mark, and the passing mark depends on the performance of other candidates. Again, for FRCR anatomy, the passing mark ranges between 150 to 160 usually every year. So if you target 160, you should be safe, right? So the question will be something like this. So you'll have a structure labeled, and you'll have to mention what structure it is. So this is, say for example, let's take this example. So this is a sagittal view. This is a sagittal view of this is a sagittal section through the elbow. So this is the anterior, and this is the posterior aspect, or this is the flexor, and this is the extensor compartment. You have a hypointense structure that is inserting to the olecranon process, and it is in the posterior, or it is in the extensor compartment. So this structure, so what is labeled here? So this is the tendon of triceps, right? Tendon of triceps. So tendon of triceps will give you full 2 marks. If you just say triceps brachii, you'll get 1 mark. If you say biceps or something like that, you'll get 0 marks, right? So that is what it means. And let's take another example. So this is a lateral view of the elbow. So where you have one of the structures that is labeled. So the structure labeled is scaphoid. So a complete answer will be right scaphoid bone or right scaphoid. So if you just say scaphoid, you'll get 1 mark. If you say right scaphoid, you'll get 2 full marks. Sometimes, say for example, if the styloid process of ulna has been labeled, then you'll say styloid process of right ulna. If you just say styloid process of ulna, you'll get 1 mark, because mentioning the side is important. So usually the mistake that people make is by not mentioning the side. When you don't mention the side, you by default lose 1 mark, right? So that is, when you're practicing, make sure you include side. So for anatomy, again, there are a lot of resources that are available. The gold standard, people say, is Veeran Abrams Imaging Atlas, but it's an atlas and it's quite extensive, but you can use it for reference. Then you have Get Through FRCR Anatomy module by Grant Mayer, which is a commonly used book, and Masterpass Anatomy. And there are a few more anatomy books, but I used Grant Mayer for my preparation. Again, for we still have we have Revised Radiology and Study FRCR running their own FRCR preparation course. So now that the 2025 exams are already over, so if you are planning to apply for your FRCR Part 1, you will be targeting either the March 2026, June 2026, or September 2026. So one thing, yeah, that you have to understand is the slots vanish within seconds. So you'll have to be real quick in booking a slot. Otherwise, you're not going to secure a slot for your FRCR exam. So for if you for March 2026 exam, the slots already opened on the 6th of October. So it's highly unlikely that someone is going to get a slot when you're trying now. Though the booking closes on the 9th of January, it hardly lasts for a few minutes. So it is highly unlikely that you'll be getting a slot currently. If you're planning for the June 2026 slot, if you're planning for the June 2026 exam, so the day you'll have to remember is on the 15th of December. So the slots are opening on the 15th of December. So you'll have to be on your toes to book a slot on the 15th of December because the slots get over very rapidly, right? So if you are preparing for September 2026, the slots are opening on the 30th of March. The booking is now through Exam Hub, the RCR Exam Hub. And the fees now, if you are sitting in India, if you want to sit the exam in India for members, it is 852 pounds per module. So it is per module. So it is 852 pounds for physics and 852 pounds for anatomy. So that makes a total of 1,700 some pounds. So that is around 2 lakh Indian rupees. If you're planning to sit in the UK, it is way less. So, but it depends on your preference if you're ready to travel to the UK or anywhere in the rest of the world. So coming to 2A, 2A is you'll have two papers of single best answers. They are single best answers and you don't have image-based questions. So this is something strange about FRCR 2A, that a radiology exam is without a radiology exam is without images. So radiology is all about images. That is what we know. But FRCR 2A, you don't have image-based questions. So the imaging features will be described in words and you'll be writing what it is, right? You'll be writing what the diagnosis is or something like that. So the exam is held twice a year and it is normally in November and April, right? So you'll have each paper will have 120 questions. So you'll have 240 questions totally. You'll have 120 questions in one paper. So you'll have total of 240 questions. So you'll have 40 questions in each of these subspecialties. So what are these subspecialties? So RCR has defined these six categories on which, so you'll have 40 questions from this, you'll have 40 questions from this, you'll have 40 questions from each of these subspecialties. So what is that you have to remember is, what is that you have to remember is, say for example, you're talking about genitourinary, right? If you're preparing for FRCR 2A, see gastrointestinal in itself, gastrointestinal also includes hepatobiliary. Gastrointestinal and hepatobiliary is going to totally give you 40 questions. But genitourinary, that is genitourinary, male, female, adrenal, obstetrics and gynecology, breast, all these together is just going to give you 40 questions. So maybe genitourinary you'll just have 10, adrenals you'll have 10, gynecology you'll have 10, and breast you might have 10 questions. So totally these are going to give you just 40 questions. So you'll have to plan your preparation in such a way that your preparation, you don't spend the same time that you spend for gastrointestinal system on genitourinary system, right? Because gastrointestinal system is going to give you 40 questions, but genitourinary is just going to give you 10 questions, right? And pediatrics will give you 40 questions. Pediatrics is something that people usually neglect, but pediatric radiology is going to solidly give you 40 questions. CNS and head and neck again will give you 40 questions, right? So when the results come, you'll be sent a mail which says your total marks, and you'll be also sent a breakdown. You'll be also sent a breakdown as to, okay, in each of these specialties, how much have you scored? So out of 40 questions, how many did you get right? And how much is your score in each of these subspecialties? You'll be sent a split up once your results are out. All right. So you'll have so these are all MCQs kind of questions. So you'll have an answer, you'll have a stem, and you'll have five options. One of these five options is correct, right? Just one of these five answers is correct. So every correct answer will give you 1 mark, and every wrong answer will give you 0 marks. There are no negative markings, right? So every single best answer question will have a clinical vignette or stem, and will have five options, and you will have to choose which is the best option of all these. Not so it is possible that you can have three or four correct options, but which of that fits the best is the answer, right? So say for example, a question will be something like this. So, a 76-year-old man undergoes coronary angiography via right common femoral artery. 2 days later, he presents with a pulsatile swelling in the right groin and mild discomfort. On examination, there is palpable thrill and audible bruit over the swelling. He is hemodynamically stable, no signs of distal ischemia. Color Doppler ultrasound demonstrates 1.9 centimeter pseudoaneurysm arising from the right common femoral artery with a narrow neck and characteristic yin-yang flow pattern. No evidence of arteriovenous fistula or active extravasation seen. What is the most appropriate management? So you will have a leading question like this. So this will be a leading question. What is the most appropriate management? And you will have a stem. You'll have a clinical stem on this, and then depending on this clinical stem, you'll have to answer this question, right? So basically, so what all features that you'll have to take into consideration is, so first thing, whenever you'll have to know about management of pseudoaneurysms. So first is that it says, okay, so someone, a 76-year-old man undergoes a coronary angiography, femoral arterial access was taken, but the question says he presents with the pulsatile swelling. So it means, if it says he presents, it means it is symptomatic, right? It is symptomatic, right? Say for example, if okay, so he's symptomatic, and the size of the pseudoaneurysm is 1.9 centimeter, which is less than 2 centimeter. And so in a symptomatic patient, less than 2 centimeter pseudoaneurysm, we'll go for immediate percutaneous thrombin injection under ultrasound guidance. So this is the answer. So say, how could it have been different is, so say for example, he says, if the question says, a 76-year-old man undergoes coronary angiography via right common femoral artery access. 2 days later, on a routine screening ultrasound, on a routine screening ultrasound revealed a 1.9 centimeter pseudoaneurysm. So if it was a routine screening, if it was asymptomatic, if it was not symptomatic, the answer will be observation and follow-up ultrasound in 48 to 72 hours, right? So that is how you'll have to read through the lines and answer the question, right? It'll be mostly applied questions. Some can be directly about asking the diagnosis as well. So these are the answers to that question. So there are many offline and online resources. The offline resource usually people refer to as core radiology, which is kind of a textbook, a revision textbook that will help you through it. And we have cracked the core. Crack the core is very commonly used by a lot of people for the exam preparation, but then it's an exam preparation manual. Then we have radiology review manual by Danhart, and then for questions, the most commonly used is SBAs for FRCR 2A by Richard Lindsay. And uh, yeah, for online resources, Revise Radiology, again, they run their FRCR Part 2 course. Study FRCR have again a 3 month and a 6 month course for FRCR 2A preparation. FRCR exam prep it is a collection of questions, very nominal cost, a good volume of questions that you can practice. This is not you don't have lectures. These are just questions. So these are model questions that you can practice every day. And then you have songs for FRCR. So this is a channel on Spotify. So these are podcasts that you can listen to that will help you for your FRCR revision. Say for example, approach to ovarian cysts. So what size, what do you have to do? So how do you have to follow up ovarian cysts, so something like that. So that is songs for FRCR. It is a channel on Spotify. These are audio podcasts. All right. So if you are planning for your FRCR to be a 2A exam, so if you are planning to sit in April, the slots have already got over on the 20th of October. So if you're planning for some time in the future, the slots for the November exams are opening on the 2nd of February, right? So I hope so, and this is for members. So for non-members, the booking is opening on the 9th of February. But invariably, without having a membership, it's highly unlikely that you get a slot. So it is kind of mandatory that everyone is a member of the Royal College of Radiologists to get a slot. And the booking fees for 2026, for if you plan to write in India, for members it is 879 pounds, and for non-members it is 1169 pounds. So if you are a resident and if you're listening to this, I would suggest that you get an RCR membership during your residency, because during your residency it hardly costs 60 pounds. It hardly costs 60 pounds per year. So, but if you see the exam fees difference, the difference in the exam fees in itself is around 200 pounds. and the booking also opens 1 week ahead for members. So it is best if you get your RCR membership if you get your RCR membership as a resident, because it is quite cheap and cost effective, right? So then coming to 2B, so I would say when with FRCR there are two checkpoints. The first checkpoint is FRCR physics, and the second checkpoint is FRCR 2B. I know people who have who have, so again FRCR 2B you have 6 attempts that are allowed. So I know people who have sit for 6 attempts and then failed. I know people who have sit for 5 attempts, failed, and then passed in their 6 attempts. So the second and the most difficult parts of all the of everything of all the FRCR exams is FRCR 2B, but it depends on country to country. I now work in the UK. I have 5 registrars with me, and they all feel that 2A is the most difficult and not 2B. But for Indians, we always feel 2B to be the most difficult because of the Viva component, but not so for the no, it is not so for the UK residents, right? For 2B, you have a reporting component and an oral component. The reporting component, you have long cases and short cases, and you have oral component, which is the Viva. So coming to the reporting component, as I told you, have long cases and short cases. So long cases, you have 6 cases to be reported within 75 minutes. So you basically have just 12 minutes per case, right? You'll have 12 minutes to go through the case and report it. And these cases might have multiple modalities. Say for example, one of the cases can be something like this. You can have a skeletal survey of a patient with hyperparathyroidism, and you can have CT scans showing multiple brown tumors, and you can have system EB scan which is showing parathyroid adenoma or something like that, right? So you can have multiple modalities. So for going through multiple modalities and reporting all the modalities, you'll have just 12 minutes plus you will have just 12 minutes of time for everything together. So time is the limiting factor when it comes to long case reporting. So how can you be so you one thing I would suggest is practice typing faster if you're preparing for your 2B reporting. Practice typing really fast. And one more I would suggest is stick to this format that the RCR recommends. So you'll have to give your answer, you'll have to report the long cases in this format. That is, you'll have to give your observations, you'll have to give your interpretation, you'll have to give what is your main diagnosis, what are the differential diagnoses, and what further management. Say, for example, you've been given an osteosarcoma, a case of osteosarcoma. You've been given the X-ray and an MR of osteosarcoma. So you'll give all the observations. So in the observations, you'll say X-ray. You'll write X-ray. You'll say an ill-defined, lucent, or lytic bone lesion involving the distal metadiaphysis of femur with wide zone of transition, permeative bone destruction, and aggressive periosteal reaction in form of Codman triangle or sunburst appearance. And MRI shows extensive soft tissue with involvement of neurovascular bundle and multiple other skip lesions or multiple other lesions or satellite lesions are seen in the tibia. So these are the observations. Then interpretation will be aggressive bone lesion involving the distal femur. Your principal diagnosis will be osteosarcoma. Then your differential diagnosis will be, say, for example, Ewing sarcoma. Ewing sarcoma, then you'll say Ewing sarcoma. You'll put a hyphen and say, but it is unlikely because Ewing sarcoma is usually diaphyseal in location, and it will be a different, it will have different appearance, and it won't have osteoid matrix deposition. And the next differential can be neuroblastoma metastasis, can be similar appearance, but it is usually associated with neuroblastoma. And then what further management? Refer to bone sarcoma center. Will need a staging. Will need a whole body MR or a PET or a bone scan to look for distant metastasis. Will need a biopsy, and further management to be decided in the bone MDT or the bone tumor MDT. So you'll have to stick to a format like this for reporting. So you basically will have a this is the window on which you'll be doing your reporting. So you'll have multiple modalities like this, or you'll have multiple windows or multiple sequences which you'll go through and give your observations. You'll type your interpretation, principal diagnosis, differential diagnosis, and management in each of these boxes, right? So again, you will have, or each case will be, you'll be scored out of 5. Each case you'll be scored out of 5, and yeah, the cutoff again depends on how everyone performs. Then you'll have short cases. Short cases have been introduced only from June 2025. You have 25 short cases. Short cases are all plain radiographs. Short cases are all plain radiographs where maybe you can have a radiograph like multiple lytic bone lesions with or multiple sclerotic bone lesions with a DJ stent in situ. So you'll have an abdominal radiograph. So you'll have an abdominal radiograph, and in an abdominal radiograph, you have a DJ stent on one side, and you have multiple sclerotic bone lesions in the pelvis and in the vertebrae and everything. So you will have to correlate and write your diagnosis. So the DJ stent, so this is usually this is possible that it is a urothelial carcinoma because there is a DJ stent in situ, and multiple sclerotic bone lesions because it's a urothelial carcinoma. Transitional cell carcinoma is one of the causes of sclerotic bone lesions. So other differentials could be prostatic adenocarcinoma and all that. So you'll give your differentials and everything. So that is, you'll have 25 plain films which you'll have to report in 2 hours. You'll have 2 hours, you'll have 120 minutes to report 25 short cases, right? And each case can have multiple findings. Most of these short cases, most of these plain films will be chest x-rays, then will be MSK x-rays, and will be only one will be an abdomen x-ray. 25 percentage of your questions will be pediatrics, be prepared, and 75 percentage will be adult. So this is the component which Indians usually suffer a lot, because in India plain films are not routinely reported, right? Plain films are not routinely reported. They are taken care of by the clinicians. An X-ray is viewed by the clinician himself, and he makes his own interpretations. They are not viewed and reported by radiologists. So this is again something that many Indians suffer. Long cases, Indians don't suffer because they have been exposed to a lot of people from residents or radiologists from India. They get, most of them have exposure to a wide variety of cases and a spectrum of cases. So they usually suffer with VIVA and short cases because X-rays are not routinely reported. So one of the examples that is given in the RCR website is a sorry is an X-ray like this, where you see a fracture of the distal radius. So you'll see so basically you'll see that this, it says it's a distal, this is how the RCR grades it. So a good answer will be like distal radial fracture through the growth plate with dorsal displacement. So this is a type 1 Salter Harris fracture. So what will you do? So associated fracture of the ulnar styloid is also seen, and phone through the to the ED and advise orthopedic review. So this is a very good response. So if you see, what is surprising is, if you see the second response, it says there is displaced fracture of the distal radius with dorsal displacement, which is a Colles type fracture. There is also a fracture of the ulnar styloid process. Joint swelling around the wrist is noted. No fracture of the carpals or elsewhere. Referral to orthopedic team will need realignment of distal radius with repeat X-ray and follow up with orthopedics. So if you see, this is more elaborate, and if you see, this is a quite elaborate response, and this gives a lot of information than the first one. But if you see the operation, whatever is necessary, so is being conveyed in the first one. So RCR, so this is again something that you will have to remember if you're listening to this. In India, we are used to writing pages and pages of long descriptive reports, but that is not what is required for FRCR, and that is not how it happens in the UK. You'll have to be straight to the point. So here you don't need long reports. You'll need very concise reports. You'll need very concise reports. So RCR calls this a good report and calls this an average report. But in in fact, this gives a lot more information than the first report, right? So this gives that you will refer to the orthopedic team. You will need it gives you what treatment has to be done, and that you need a follow-up X-ray to a check X-ray to see if it has been realigned and everything. But then RCR calls this a good answer. So your answers have to be really concise. So practice concise answers. Don't practice elaborate, extensive, wordy, descriptive answers. Right. So again, short cases are you'll be marked. Each short case is marked for 5. And the most important, most difficult of 2B exam is the oral component or the Viva. So Viva, you'll have 60 minutes. In 60 minutes, you'll take two stations. Two stations, each station will be for 30 minutes, right? So you'll have station one and station two. Station one, you'll have 30 minutes, and station two, you'll have 30 minutes. In station one, you'll be shown 6 cases, and in station two, you'll be shown 6 cases, right? So station one will have examiner one and two, station two will have examiner three and four. All right. So examiner one will show you 3 cases. Examiner two will show you 3 cases. Examiner three will show you 3 cases. Examiner four will show you 3 cases. So totally it will be 6 cases. You'll have 15 minutes with each examiner. You'll have 15 minutes and 3 cases with each examiner. So overall you'll have 12 cases, right? Over 60 minutes, which you'll have to give the answer, right? So you'll be scored out of 5 domains, that is radiology knowledge, observations, clinical reasoning, clinical safety and management, and communication domain. I'm not going into detail of this. And you'll have to score out of 400, you'll have to score a minimum of 281 marks in Viva to pass the exam, right? So if you have failed, so how is the total? So if you have passed in all three, you have passed in all the three, you have passed the exam. But if you have failed in one of it, if you have failed in one of this, so if you have failed in the Viva component, you should have scored less than one. You should have scored within. Sorry, you should have scored within half SEM, half standard error of measurement. So you should have scored within half SEM and failed the oral exam. Otherwise, you'll fail the whole exam. And if you failed in long case or short case, you should have failed it by within one standard one SEM. So if you failed more than with a deficiency of more than one SEM, then you'll fail the exam. Again, you have a lot of offline resources that are available. The textbooks are Rapid Review of Radiology by Shahef Hussain and Top 3 Differentials by William O'Brien. And Chapman is a very good book that you can use for your FRCR 2B to learn all the differentials and the salient features. And you have books like Long Cases for Final FRCR 2B by Rebecca Hanlon. But the most popular than offline resources for 2B, people usually prefer online resources. So the most widely used is Revised Radiology. Then you have FRCR tutorials by Dr. Samir Shamsuddin, which is again a platform that gives you that you get long cases, short cases, and Viva. And FRCR Longs is another platform. RAD exams and Study FRCR we are still developing, and you have a lot of Viva videos that are available on YouTube by Dr. Sandeep Aval, that is from Radiology Vibes, and FRCR Vivacity by Dr. Vaibhav Nichat. And if you are planning for, so you'll be writing your reporting one day, and then you'll be given a date for your Viva on some other day. So if you're planning to sit for if you sit it in March, it's the bookings are opening tomorrow, right? If you're planning for the January sitting, the bookings are already over. And for March sitting, if you're planning for your March sitting, the bookings are opening tomorrow on the 3rd of November. Right. So if you're planning for the June exam, it's opening on the 12th of January. If you're planning for the October exam, it is opening on the 7th of April. The cost is, if you're planning to sit in India, the cost is 1,515 pounds. So, or 250, 2015 pounds if you're not a member. But if you are a member, the fees is 1,515 pounds. right? So what is the ideal preparation timeline for every part of the exam? If you're not working, and if you are at home and you can give a dedicated preparation, in the sense you'll read the whole day, then it is enough if you do 3 months of focused preparation. And if you are working or you are in training, I would say you start minimum of 6 months before the exam. So you start at least 6 months before the exam, and make sure that you are consistent. Consistency matters, because 6 months you'll tend to lose interest. But I would say start at least 6 months if you're training or if you are working somewhere. At least 6 months preparation for anything will be necessary. But if you're a first year resident, the ideal timeline I would say is, if you're a resident, okay, you can give your part one in first year, give your part 2A by the end of second year or the beginning of third year, and give your part 2B immediately after your final exams, right? So part 1 in first year, part 2A in the by the end of second year or the beginning of third year, and part 2B by then once you're done with your board exams. So you would have read for your board exams and you give your 2B as well. So, what are the core principles is you'll start early as possible and be consistent. You'll practice a lot of questions, and you will have to understand that you cannot memorize. It is about clinical reasoning more than facts. It is more of clinical reasoning, and solve questions alongside. So one mistake that people do is they they just read and they don't practice questions. Practicing questions is very important for the FRCR preparation. So for part one, the most difficult will be physics. So for physics, you'll need to develop a clear conceptual understanding of everything. So, and for anatomy, you'll need visual pattern recognition. So that'll for anatomy, you report more. When you're reporting, make it a point to identify all the structures in your daily reporting in your college or in whichever wherever you're working or wherever you are currently. So make it a point you specifically make an effort to identify each structure. For part 2A, you'll need systematic reading. You'll need systematic reading, and you'll also develop a lot of you'll accumulate a lot of knowledge with 2A. And for 2B, I would say begin with Viva practice. Begin with Viva practice, and then go into the reporting components of it. And because Viva is the most difficult, and preparing for Viva prepares you for short case and long cases as well. So I would summarize that FRCR is not just an exam, it is a journey. I started my FRCR journey as a first year resident when I was at Maulana Azad Medical College. And from then, with each step, it makes you evolve into a better version of yourself. You'll learn a lot more, and you'll start understanding things better. So this makes you, I really feel giving FRCR will make you a better radiologist, in the sense you'll accumulate more knowledge. You'll be more you'll be able to you'll approach radiology in a different way, and FRCR prepares you for it, right? So as with every journey, you'll have highs and lows, and you'll have confidence and doubt. You'll have good days and you'll have bad days. This is so with FRCR journey as well. When I started my FRCR part one, I never thought that I'll be able to finish my 2B and I'll be able to move to UK someday. I never dared to dream all this. But then this all happened, and you will have good days, you will have bad days. It is a journey, because it is not like one exam and you're done with it, but it is like you have many exams, you have multiple exams, you have three parts which you write over, maybe provided you get slot every time, you take at least 2 years to finish your full FRCR. Right. So it is a journey which you'll need consistency, and which you'll need a lot of motivation. But through it all, keep moving forward. Every preparation, every mock, every small step will eventually add up. See, it is not that okay, everything will add up to something, right? Every single case you see might add up to your 2A preparation or 2B preparation or something like that. And remember that when you are in your FRCR journey, you're getting closer every single day to your dream. Because and you won't realize that until your dream has been realized, right? So I am on this side, so I'm telling you my own experience. And it was never that I never realized, or I never imagined that that this would become a reality someday. But once it became a reality, I was getting closer to it every day. So every single day, every single effort, you are closer than you were before. So be consistent, be realistic, and be kind to yourself, because this is a journey and you'll have to be patient with yourself. It takes time, right? So that is all I had to say. And I'll be happy to take any questions regarding FRCR preparation or life in the UK, or anything about that, or what after FRCR. I hope to do another webinar on life after FRCR in the UK. What are the job opportunities? What can you do? How do you become? What positions do you have? And how can you uh, how do you access all this, and what should you be doing, and everything. So I hope to be doing a session on that. So if there are any questions on FRCR preparation, or anything related to FRCR, I'll be happy to answer.